Welcome back to this session, and today what I'm going to do is I'm going to give you a review and recap of the whole programme. Then I'm going to be talking about the benefits of exercise for osteoarthritis, and then we're going to be talking about pain relief, which is going to be the main topic of this session. There will be a video towards the end of the session talking about cycling technique. So, osteoarthritis is estimated to occur in about 8.75 million people over the age of 45. That's 33% in the UK. And those are just the people that have sought treatment for osteoarthritis. The figure may be more than that. The main guidelines that we refer to when we treat people with osteoarthritis are the NICE guidelines. There are three main core components. The first one is education, advice and access to good quality information. The second one is exercise for muscle strengthening and aerobic training. The third component is weight loss if you are overweight or obese. Why exercise? Well, exercise has been shown to be beneficial in lots of many ways. So we've got some examples here up on the screen. It lowers the risk of cardiovascular disease, lowers the risk of diabetes. It improves our strength and coordination, so it reduces the risk of having falls. It helps manage our weight. It improves our psychological well-being. People feel better when they exercise. It improves stamina and improves our sense of energy. It also strengthens our bones and muscles and improves our mobility, a way of getting around, and our flexibility. So why are we choosing cycling as a form of exercise? Well, cycling is a way in which we can mobilise the hip towards an end of range, and we can do that again and again and again in a way that other interventions simply can't do. It also means that there's less impact going through the joints. It's also a very social way of participating in activity. It also has been shown in the research to help strengthen the muscles, particularly in the lower limb, and especially the ones around the hip. It's a form of cardiovascular exercise, which we know is good for our heart and lungs, and there's lots of good systemic reasons for exercise in terms of improving our hormonal balance and improving how we feel, so it has a good psychological effect. Exercise can also provide us with what is called exercise-induced hypoalgesia. Simply, that means pain relief. So if we dose exercise right for you as an individual, it is very reasonable that we can give you pain relief purely by exercising. Now I'm going to talk about pain relief. There are different ways in which we can receive pain relief. We can take tablets orally. We can take non-steroidal anti-inflammatories, which are also tablets mainly. And we can also have or use topical treatments, such as those which are on the skin. Paracetamol, which is an over-the-counter medication. Examples are Panadol or Anadin. The method of how this medication or paracetamol works is relatively unknown, but we believe that it reduces the production of prostaglandins and therefore it reduces the sensitivity of pain. NICE guidelines recommend paracetamol ahead of oral non-steroidal anti-inflammatories because its risk profile is very, very low. We can also use what's described as topical analgesia. So that's pain relief that we use by rubbing these products on our skin. Examples include Nurofen gel, Ibuleave and Voltarol. Some of the research suggests that there are some short-term benefits for it. However, long-term we're not sure. But it does reduce the risk of getting stomach upsets, and they're safer to take than non-steroidal anti-inflammatories. So NICE guidelines do suggest considering a topical anti-inflammatory or paracetamol in front of, or as a preference, to taking oral anti-inflammatories or opiates. Other products include capsaicin, which again can be applied onto the skin. We believe this works by interfering with substance P, which is a chemical involved in transmitting pain impulses throughout the nervous system. Typically, this takes 1 or 2 weeks for pain relief to occur, and NICE guidelines recommend considering capsaicin for the treatment of osteoarthritis. Moving on to non-steroidal anti-inflammatories, examples are aspirin, ibuprofen, which are over the counter, but you can get naproxen, which is a prescription-only medication. Non-steroidal anti-inflammatories work by reducing inflammation by inhibiting certain enzymes, COX-1 and COX-2 inhibitors. They are effective at reducing inflammation, but they might cause stomach upsets and, in the long term, problems with the heart. You can be prescribed a proton pump inhibitor, such as omeprazole or lansoprazole, which then counteracts the effect that it can have on the stomach. When we consider pain relief, we do consider pain relief across what's described as an analgesic ladder. At the lowest part and the safest is paracetamol, but then if we need something slightly more for moderate or severe pain, we do consider opiates. Examples of opiates include codeine, dihydrocodeine, tramadol, and they act directly on the nervous system and can be used in conjunction, as also paracetamol, can be used in conjunction with non-steroidal anti-inflammatories. It's important that if you find a medication that it has an opiate base, such as cocodamol, that also has paracetamol in it. So I would not recommend taking paracetamol with cocodamol. One of the risk factors that surrounds opiates is it can cause constipation, nausea, itchiness, drowsiness, confusion. It's not recommended to take in the long term. And we can become used to taking these types of medication, and the effectiveness of it does reduce. Other methods of pain relief include rubefacient, which include deep heat, Radiant B, and they're available as a gel or cream. These products warm up the skin and can be available via prescription or over the counter. NICE guidelines do not recommend the use of this for treating osteoarthritis, but we find anecdotal evidence that it does help a select group of people, but we just don't know who those group of people are. Let's hear from one of our past participants.
You get on a stationary bike for the very first time, and it was quite an effort, but by the end of the course it was a delight to get on, because I was beginning to realise that it had a real benefit. My pain levels were totally manageable virtually by going spinning, and I had some pain midweek, perhaps always towards the next appointment, but it worked, if you can tell me what it is. It didn't go away, but it worked to relieve me of personal pain, and I've been very grateful for that ever since.
Here we have a video which shows the cycling technique of low resistance and high cadence.
Okay, so this week you're going to be concentrating on the cadence, the speed of your pedal action. So you can see with Erica here, she's got a nice steady speed. And what we want you to concentrate on is having a low resistance and a high leg speed. So don't worry too much about what your resistance is doing, but really concentrate on what's happening with the legs. And the idea is that you're not putting any undue pressure through your hips, your knees or your ankles, but you're actually challenging your cardiovascular or your aerobic system to increase your physical fitness to be able to continue spinning or cycling for longer.
So to summarise week 2, pain relief is sometimes required to help manage the symptoms of osteoarthritis, and it's really important to know that if you take pain relief, you're not masking the pain in such a way that if you exercise, that you could be causing damage to yourself. That simply isn't true. You can use pain relief to help reduce your symptoms, to allow you to exercise and also to sleep well, and we believe that pain relief can be used in a very helpful way for your symptoms and for the treatment of osteoarthritis. There are a wide variety of pain relief modalities, and all of you will respond to them in a different way, so it's often important to find out what seems to work for you best. The NICE guidelines recommend paracetamol, topical analgesics ahead of oral anti-inflammatories, and opiates, and as you've seen in the video, the cycling video shows low resistance and high cadence.